Good afternoon. This is Consumers Doctor, Dr. Bengala. Today is September 29th, presidential debate in Cleveland Clinic, Ohio. In a couple of hours, both the candidates will be talking about healthcare. Let's talk about the healthcare. I have no problem with both the candidates personally, but what I need to maybe make it clear what is the best option for Americans. I understand, there is a passion out there, people who have no coverage, people who have no insurance, even among the immigrants, they have no coverage. I understand all that passion out there. What about the Americans? What is it? What is it? So I keep saying this healthcare bill, so-called Obamacare, is not really about Obamacare. Believe me, it's nothing to do with healthcare. Obamacare is nothing to do with healthcare. It's all about independence. Independence. Do you get what I'm trying to say? Independence for all the Americans. What I mean saying that independence, where, as Abraham Lincoln stated clearly, America can never be defeated from outside. It will be if we falter on freedom. This is coming down to the freedom and independence. We have 160 million blue collar workers. They already have insurance. They already have the insurance. And 60, 70 million Medicare, government subsidized, they already have the insurance. And, the problem is only for, I would say, even if you maximize it, 30 million Americans don't have the insurance. I understand that. But there are ways to do it, folks. There are ways to do it. It is not that just to cover the 30%, you have to put gun to your rest of the Americans to say, hey, let's make it one size fits all approach. It doesn't work. I would like to see Americans be happy, and Americans can take care of their own health. If you really look at other retail industries, Americans know how to shop for the healthcare. They also know if there is a competition, if there is a transparency, if there is freedom. Believe me, the cost of the healthcare will go down. Right now, one candidate, you know, wants to say he wants to have one size fits all approach and Medicare for all. Medicare recipients are already happy. Why take away their rights? And private insurance private insurance people who are covered under, they're already happy. But you need to address, how do you prevent from rising healthcare costs? That is the bottom line. We are not addressing that. We are basically going after, all the Americans in one size fits all approach. It will never work. There has to be, you have to empower. I would like to see empowerment to the Americans. This is what is all about. This country is based on empowerment. How do you empower? I'll tell you how. It's a simple, folks. It is very simple. We already have, private insurance companies, but the healthcare, even though we have spent $3.7 trillion in 2018, we ranked 37th in the world, folks. We ranked 37th. Among the countries, what they are saying, like Canada, England, Germany, whatever you call it, where do they rank in healthcare? I wonder. America wants to be number one. How do you make it number one? Not by having one size fits all approach. It doesn't work. I don't know how policymakers can jump onto the bandwagon. It's like putting gun to your head. Hey, you have this, I have nothing. You can't do that. There are ways to empower the Americans. How do you do it? One thing is the existing traditional insurance premiums are not working. Even though people are paying year after year, year after year, year after year, premiums 16, 18,000 for a family of four, 160 million people. I just did a simple math. I multiplied 160 by $16,000 per year, which you'll never see it. You know how much it came to? $2.88 trillion. Year after year, year after year, consumers are putting the money and you don't see anything in return. Come on, you have to have insurance. You have to have insurance where some of the premium should get back to you. It's as simple as, if you can get a deductible policy. I think there should be insurance reform in such a way traditional insurance should go away, and they should make it high deductible health plan, maybe up to $2,000 to $3,000. Initially, employer takes the burden of the deductible part, but later on, the workers will take the responsibility of their own health. Individuals will take care of their very first year. It is difficult to come up with $3,000 deductible. I would say even government should subsidize some type of $3.7 trillion. When you look into it, it comes to $10,000 per person for the entire population. Each individual, US is spending more than the national defense budget. For the first time, we have surpassed the national defense budget. It just doesn't make sense. Healthcare can be brought down by one principle: put the consumers in the driver's seat. I can bet you, the premiums will go down and healthcare costs will go down, because you know what you're doing? You're empowering the consumers to save money. When it comes to saving money, believe me, just for the healthcare, they will pinch a penny to spend that money, and they will take care of their own health. Look at the obesity is a common problem in this country, because there's no reason we can't educate the public. The food, health is so critical. Majority of the Americans take care of their health, but small segment of it, they have to modify their diet, and obesity will go away. I can bet you, if you empower the Americans, if you empower the average folks, they will watch that diet like a hawk. I'm telling you, this is what it is. Right now, nobody is focusing on the diet. It's a simple thing to change your diet, physical exercise. You can, and also yoga, meditation. Those are all the simple things to follow, and you can change the behavior, because only way how you modify the behavior, by empowering them, by making them pay for it. How do you pay it? You have already spending. American government is already spending $3.7 trillion. Invest that same money into the average Americans, folks, especially people that 25, 30 million poor people who can't afford it. We can give them the guaranteed coverage for those folks. Certificate of guaranteed coverage. Yes, Health Review Authority is a public-private partnership. Set up a public-private partnership. And Health Review Authority, anytime the insurance companies deny the coverage for whatever the reason is, the pre-existing condition is too hyped up. If once you empower the Americans, that pre-existing condition doesn't even arise. Once you empower the Americans, there are 25, 30 million people who don't have the coverage. Health Review Authority will give you the guaranteed coverage. And insurance companies have no other choice but to provide it, because your government is guaranteeing the coverage. If insurance companies don't participate in those plans, insurance companies are the losers. Believe me, that's the way it is. If the insurance companies don't participate in the government program, the insurance companies are big time losers. So once you have a deductible health premium, your premiums will fall by at least 30 to 40%. That money, put it in the personal care health savings. Actually, you know what? This policymakers should mandate. I would like to see it mandated, because Americans are not good at savings. This is where Americans have to learn from the Eastern European countries. Americans hardly save money. This is the time, folks. This is the time. Give the Americans and help them save money on healthcare. Once they start learning how to save, and the money which is in the personal care accounts, health savings account, they can't use it for anything else, folks. So average Joe, people has no job, unemployed, they are on EBT. Even people on EBT cards, give them the certificate of guaranteed coverage. So what will happen is, give them incentives. Well, if you save money, that portion of the EBT money will be put aside into your savings. Isn't it a right thing to do? You are basically, this whole policy depends on how you take care of your poor, indigent, handicapped, uninsurable population. If we all can do that, this country will come out a long way. I can bet you this country will be number one in healthcare delivery. Free enterprise. America always shines. America always shines in the free enterprise. When you say Medicare for all, that is we can't even afford it unless you want to raise everybody's taxes. Why can't you put the money in Americans' pockets? What's wrong with it? I don't understand policymakers sometimes. They want to give them something for free for nothing, with no individual responsibility. This is where the United States can shine. Individual responsibility, folks. If you don't have individual responsibility, it's just not going to work. Everybody has. There are some segment of the population can, take care of themselves. I understand all that, but with certificate of guaranteed coverage, everybody, people on the street, homeless, even they should get a certificate. Everybody should get a certificate of guaranteed coverage. People who can pay the bills day to day. I see in Long Beach, people are on the street. They're, with their shopping cart, they have nothing. I come from a poor country, India. We have 1,400,000,000 people. You know how much India spends on the healthcare? Is 1.5% of national budget. 1.5% of gross domestic product, GDP. And where we are, America is spending 18 to 19%, and we still lag behind. And I'm sorry to say, we lag behind India. Believe me, I've never seen the money being spent and being wasted year after year. Something can be done about it. Singapore, a small, tiny country, is in top five. Why can't we adopt the same model? Provide and help the needy, help the people who don't have the insurance, help the people who can take care of themselves, put them in the facilities. That's the government's responsibility. I wish the Democrats focus on people on the street and put them, and half of them have psychological problems. There's no doubt about it. And with this telemedicine technology is changing the way, unbelievable. Telehealth is going to change the entire healthcare. I see telehealth, telemedicine, healthcare is going to be changed. I am a consumer's doctor. I'm focused on technology. I would, as a matter of fact, I would like to bring more competition, more transparency. I'm going to invest where my mouth is. I'm going to put hubs, which is a one-stop place for for them to give the care what they need. Half of the 30 to 40% of the folks can be treated on telemedicine, and another 20% would have 20% psychological problems can be treated in telemedicine. People with chronic illnesses, hypertension, diabetes, blood pressure, they can be treated on telehealth. You have 20% of the 20 to 30% they need to be examined. They can be seen in the hubs. They can be followed up in the hubs, and they can have all the diagnostic modalities in the hub. And they can have surgeries in the hub. Yes, surgeries in the hub. And they can be recouped in the hub. They can be recouped in the subacute setting, and they can be recovered. A month or two, they can stay in the hub. This is a nice concept, folks. This is where the healthcare needs to go. And meanwhile, while that is going on, you need to provide the alternatives. You need to empower the Americans. You need to empower common folks. I'm not, I'm not rich, but I have thought about it. I've set up a health savings account a long time ago. I don't have much, but at least I have reasonable amount put aside just in case if I need it. I can use it. I can shop wherever I want to go. If they want to charge me $200,000 for the heart surgery, I had an angioplasty. I got a bill for $227,000. How about that? For a 23-hour stay in the hospital. How do you justify that? I just can't believe. How do you justify $227,000? And the stupid Medicare, they pay 35 grand. Medicare pays 35 grand, and the reason they hype up the bill, they can collect more money from the secondary insurance. So they collected 60 grand for a 23-hour. Does it make sense? I could have had the same procedure as Deepak Shetty, one of the well-known cardiac surgeons. He does cardiac surgery for $800 right in Cayman Island. I don't even have to go anywhere else. I can go to Cayman Island and have a cardiac surgery. And they do for children with holes in their heart. He charges $800. Yes. That's got to be better. It's a matter of how you want to talk about delivering healthcare. We can all say, hey, let's give them everything free. But that never works. India, we have billion for 400 million. We don't have a social security. We don't even have unemployment. People live day to day. 30% of the population, they live day to day. You know what? They're happier than American, typical average American. They're happier because they and everybody as a society. As Deepak Shetty said, God will take care of India. You know, Indian government is spending 1.5% of the GDP, and here we are spending 18 to 19% of the GDP. We still rank bottom of the most advanced country. We are the advanced country. We rank in the bottom. How about that? How do you justify that? You think Medicare for all is going to resolve all these issues? Come on, folks. Common sense. Medicare for all is going to bring America to be number one in healthcare delivery? No, it's not going to happen. There's got to be other solutions. People have to open their eyes, open their mind, talk about healthcare delivery, empower the consumers, empower the Americans. Americans can handle the healthcare better than, they have a lot of people, most of the Democrats, they seem to think the Americans are brainless. They don't know how to think. Come on. Americans are smarter than what average forces. They can handle the better, okay, healthcare better, and give them the independence. That's what we need, independence. We all say the Second Amendment and the First Amendment. Yes, this becomes the Third Amendment. Let's do it. Come on. We should have a healthcare for all through empowering the Americans. Let's make it a part of the thing as a Second Amendment. Make the Third Amendment. Make whatever it is. You should empower and let America shine. As Ronald Reagan said, America will be a shining city on the hill. I can bet you. I'm betting you, America will be a shining city on the hill. If you guys are all listening, a lot of people, have misgivings about Donald Trump. I understand that. But what he has done to this country, I've been in this country for 45 years. I have never seen any president done so much in such a short period of time. I believe in him. Basically, whatever he has promised, he has delivered it. Why not to give him a chance for another 4 years? And I can bet you he will solve the immigration. He will solve the healthcare too. I can bet you healthcare will be resolved once for all by empowering the Americans, folks. Let's do that. If you like this channel, subscribe. As a matter of fact, I'm thinking of going live and keep talking about this healthcare issues, which is I'm passionate about it. Healthcare is so regulated. California Medical Board basically let me lose. Basically, they told me, because of some fraudulent charge, they wanted me to quit. I said, fine, I can survive. California Medical Board was so stupid to lose a talented young physician. This is about 5-6 years ago. They let me go from practice. I was the number one urologist in the desert. You know what? I didn't lose anything. People lost because California Medical Board is under tremendous pressure because every fraudulent complaint they want to they want. I understand the logistics, but I'm glad it happened. I love it. I am so passionate about healthcare. That's why I assume the role as a consumer's doctor. And I want to represent the consumer. I'm not representing the providers, either the doctors or hospitals. I am representing the average folks, especially poor, especially indigent, impaired, disabled. Yes, I have a non-profit organization. We give vocational scholarship. I wish we can help people who can't afford the healthcare. I wish my nonprofits can do that. That's what I'm looking forward to see if I can help people who can't afford. That's what the foremost organization goals are. So if you do like this channel, subscribe, and I'll be going live regarding the healthcare for all, folks. Healthcare for all. We'll see you in the next episode. Thank you for joining.